How can I understand my neurological assessment results for stroke? When you or a loved one has a stroke, understanding the results of neurological assessments can feel overwhelming. These tests are designed to give doctors a clear picture of how the stroke has affected the brain and body. They use standardized tools to measure the severity of the stroke, the level of disability, and to guide treatment plans. Let's explore what these assessments mean and how they help in your recovery journey. One of the main tools used is the National Institutes of Health Stroke Scale, or NIHSS. This scale looks at different functions like consciousness, vision, movement, sensation, speech, and attention. Each area is scored, with the total score ranging from 0 to 42. A score of 0 means no neurological problems, while higher scores indicate more severe impairment. For example, a score between 0 and 8 usually suggests a mild stroke, and recovery tends to be quicker. Scores from 9 to 15 are considered moderate, and above 16 are severe, often meaning more significant challenges. These scores help doctors understand how much the stroke has impacted your brain and predict potential recovery outcomes. Another important scale is the modified Rankin scale, or MISS. This scale measures how much your daily life is affected after a stroke. It ranges from 0, meaning no symptoms at all, to 6, which indicates death. A score of 1 means you might have some symptoms but can still manage most activities. 2 suggests slight disability, where you can look after yourself but may need some help. 3 indicates moderate disability, where walking might be possible but assistance is needed. 4 shows a more serious disability, like being unable to walk or care for yourself without help. Understanding your MISS score helps your healthcare team plan your rehabilitation and support needs. Emergency responders also use quick assessment tools like the Cincinnati Pre-Hospital Stroke Scale and the Rapid Arterial Occlusion Evaluation Scale. These help identify signs of stroke rapidly, such as facial drooping, arm weakness, speech difficulties, or gaze issues. The RACE scale scores from 0 to 9, with higher scores suggesting a greater chance of a large vessel blockage that might need urgent specialized treatment. These tools are vital for making quick decisions about where and how to treat stroke patients. A thorough neurological exam goes beyond these scales. It looks at your mental state, including alertness and language skills. It checks your cranial nerves, which control vision, eye movements, facial sensation, and speech. Your strength, coordination, and sensation are also tested in your arms and legs. Reflexes and coordination are examined to find any abnormalities. All these findings are combined with the scale scores to give a complete picture of how the stroke has affected your brain functions. Imaging studies like computed tomography scans or magnetic resonance imaging are also crucial. They show the location and size of the stroke in your brain. For example, the Alberta Stroke Program Early Court Score helps estimate early ischemic changes in the brain tissue. When combined with your neurological scores, imaging helps doctors decide the best treatment options, such as clot removal procedures or medication. If you want to understand your results better, don't hesitate to ask your healthcare team to explain what your scores mean in simple terms. Remember, these assessments are tools to guide your care and are not fixed predictions of your recovery. They are repeated over time to monitor progress or catch any complications early. Always discuss your results with your neurologist or stroke specialist, who can provide personalized insights based on your unique situation. In summary, understanding your neurological assessment results involves knowing what the scores and exam findings reveal about the severity of your stroke and how it affects your daily life. These standardized tools help your medical team plan effective treatment and rehabilitation strategies. Keep in mind that every stroke is different, and your recovery journey is unique. Always seek personalized advice from your healthcare providers to get the best care possible.